Good afternoon, good afternoon, readers. It's I'm a little flustered today. Apparently, it's that was the worst intro ever. This is Mark Gentili. I'm the editor at Sudbury.com. We're back for another live conversation with one of our officials, elected officials or otherwise, in Greater Sudbury. Mayor Brian Bigger. I'm pleased to have him back with us today to talk about the COVID-19 response, the situation we find ourselves in today.
Thank you very much for the invitation, Mark.
Well, I appreciate you joining us once again, Mr. Mayor. So let's get right into this. We're a day out from the Easter long weekend. The big message we're hearing from officials today, Mr. Mayor, is that it is, doubly important that this weekend being a holiday weekend, that people, as much as they may want to celebrate with friends and family, they really need to stay home.
Well, absolutely. And I released another statement yesterday, just reinforcing the messaging from Dr. Sutcliffe. She's my advisor. She's the person with the authority in the position at this time that is giving us the direction and the support from a public health position. And it's a really simple message: stay home, and it means everybody stay home. And it doesn't matter if you only live in Sudbury. Everybody stay home. And if people do stay home and they take that message to heart, they'll actually be doing a good thing for our community and for their own communities. And so it applies to everybody. People should not be planning on driving down to Toronto and the GTA, the hotbed of coronavirus right now, and then coming back to our community, because it's kind of like we'll find out what happens if people start doing that, and we'll find out 2 weeks from now how that's affected our community, and I don't think they'll feel good about starting COVID in our community.
Well, you did issue a statement yesterday. You're not only calling on people to stay home, but asking people who aren't from Sudbury to stay home as well, to not come. We like to have you visit us, but please don't visit us this weekend. I don't know if I was wondering if you had seen this story out of Chicago yesterday about a Superspreading event. Did you happen to see that story?
No, I didn't see that specific story.
And it kind of, I think, to me, sort of highlights the message that you have pushed and the message that Dominic Giroux, the hospital CEO, pushed this morning when I spoke to him, and which Dr. Penny Sutcliffe has mentioned earlier this week when I spoke with her, is that, the Superspreading event in Chicago, a man went to a dinner, he went to a birthday party, and he went to a funeral. He shared a potluck meal with some people. He shook hands, he hugged people, he shed a few tears with friends and loved ones, and that was back in February. From that one event, 15 people were infected, and 3 of those people have gone on to die from COVID-19. That is the sort of event I think that you're talking about when you say you want people to stay home and, stay in their homes and not have, Easter dinner with their loved ones this year.
Yeah, we're not saying that people would do this intentionally. And unfortunately, people can be asymptomatic, which means they can have absolutely no symptoms and be spreading the virus if they've come in contact with it and picked up the virus themselves. And so, unintentionally really hurting your friends, your neighbors, your family, there's no need for that. And so, these are unique times. And we have to make some sacrifices, but it's very, very important. As you said, Dominic Giroux, Dr. Sutcliffe, any of the experts are advising, please stay home. And that absolutely is the message. If everybody follows that, then we should get through this weekend and the next few weeks well. And people, and as you said, it only takes one. If somebody comes back and they are infected and they're not observing proper physical distancing, they could end up going shopping in the grocery store or something like that and infecting a lot of people. And what happens in these kinds of events is the risk is it will it'll take our hospital over its capacity to be able to take care of you. So, think about it, you and your family not having the level of care that you're expecting when you go into a hospital because it's over capacity because of a surge in these cases. So we've seen it happen around the world. I think that Sudburyans are smart. I think that Sudburyans, they understand if they're aware of these types of situations, they still have the opportunity to call 311. We've made that very public. Our bylaw enforcement people and we've essentially doubled our resources in doing patrols, going out in the communities, trying to identify where we have examples of people who are not following the directions of our medical officer of health, and we'll have a conversation with them.
Have you laid any charges? Have any charges been laid yet?
We've laid charges against one business owner, and up to this point that I'm aware of. And in that case, quite frankly, it started off with education and communication, but when it was clear this individual just had decided they weren't going to comply, well, the charges got laid. Okay. And so we hate to go to that extent, but certainly have the authority and some of the fines, particularly if people have orders for isolation, orders from the medical officer of health, those fines can be very, very strict.
And I know police I've heard of Okay. Sorry about that, Mr. Mayor.
No problem.
The joys of live video. Are we back, Aaron?
Yep.
Sorry about that, Mr. Mayor.
Not a problem at all.
So, as I was saying before my microphone, rebelled upon me, I've heard of several occasions where Greater Sudbury Police have gone to people's houses who are not practicing social distancing, who have had, or having people over in their backyard and have basically broken up the party. Have you heard this or?
Yeah, absolutely. Yeah. I've been in contact with Chief Pedersen and well aware of their operations. In fact, like I said, we've doubled the number of people that are out in the community trying to communicate and educate and as well ready to enforce if required.
Are you now? As I was telling you before we started today, the Sudbury.com daily poll, today's poll, asked readers if they planned on ignoring social distancing directives this weekend because it was Easter, and unsurprisingly, there were a number of people who answered that yes, they would be ignoring, or they were not sure, but possibly they would be ignoring these directives. Are you concerned that there are people out there who just aren't getting the message?
No, I think people are getting the message. I think people are messing with your survey a bit, perhaps. I do believe that people are getting the message. However, we are ready to enforce. Like I said, we've doubled our numbers, and we are ready to respond to 311 phone calls, and so we're in I think in a good position. You've heard so many community leaders please stay home this weekend. Celebrate Easter with your family from within your household, and there are so many options to connect with people electronically that it shouldn't be that difficult.
We've heard there was a number of new developments, of course, every day in this. But today, of course, we learned that there is now an outbreak. There's I think 3 new cases in Timmins. They've declared an outbreak at a nursing home in Timmins. There is a COVID-19 case in the pediatric unit now, so a child in Sudbury with potentially with the disease. I think there's been a death in Thunder Bay, and now at Brampton Civic there was a hospital worker who has died of COVID-19. What goes through your mind when you hear these sort of all of these statistics and all of these all of this news that the disease just keeps spreading and through the communities?
Really, it just, for me, it reinforces. I mean, people think this is only going to affect, let's say, seniors, and we have somebody in the pediatrics wing here in Sudbury right now. So think of your family during Easter, and that's why the messaging. This is the time to think about how this could affect your own family, so I care about everyone in our community, care about the more marginalized people in our community, the vulnerable, the seniors, the children, everybody in our community. And so as a community, it's not only about you, it's about other people in the community too, and just keeping them safe. So we want to see what's happened in New York or Italy, or pick your example. If we're all responsible and taking that responsibility seriously, we will be able to protect our own families and people within our community. Okay. As far as the long-term care facility goes, there have been a number of interviews of our staff in the long-term care facility, and absolutely top of mind, basically every day. Getting updates, what's happening in the long-term care facilities. I'm proud of the level of testing that we're doing in Pioneer Manor. We're testing temperatures twice a day, patients and staff, and we've got a pretty rigid screening practice. And so we're doing everything that we can, in our power to protect people in those circumstances and across the community.
Right. And we're hearing, of course, Doug Ford yesterday, the Premier said that it was the Ontario's level of testing was unacceptable. He wanted to start seeing 13,000 tests, the most that we can do, done every single day. But now we're hearing, of course, that there is a shortage of swabs to do those tests. So,
fortunately, our healthcare workers and people working in long-term cares and paramedics and such are the top priority for the testing. So certainly, if they're showing any symptoms, I'm confident there's enough capacity to test people with the symptoms, and we need to focus on the people that would be there to take care of us if by chance we did catch COVID in one of them. And so realizing as well, it's such a high stress environment in a global pandemic. Having live COVID viruses in our community and around, we have to assume that we have COVID in our community. It is stressful. We need to ensure that we take care of our healthcare workers on the front lines, so that they feel comfortable in coming to work and that they're kept safe as well.
Right. Now, Peter Zalen, Dr. Peter Zalen, he's a columnist at Sudbury.com. He's the past president of the medical staff at Health Sciences North. He's also a member of the physicians group, Sudbury Manitoulin Physicians Group, and that group is lobbying for stronger measures. They would like to see basically Northern Ontario closed off to any non-essential traffic at all in order to protect the region from the spread of COVID-19 in the south. Now, I know I've asked you this question before, but is that something you think it's time to start entertaining?
So, obviously, listening to Dr. Zalen, and I appreciate what he is saying. our medical officer of health is I'm absolutely in contact with Dr. Sutcliffe on a continuous basis as well. And so, just what I can say is that, nothing is off of the table. Constantly considering the environment that we're in, the cases that we're in, conversations with our medical officer of health, other people throughout the community. So at this point in time, I understand what the call is. I think the message that we've been relaying to citizens, stay home, is very easy to understand and very clear. And I do believe that people are restricting and minimizing the trips outside their homes to essential trips for the most part. And so they're following directions. And so I'm confident that Sudburyans will continue to follow our directions on this. And I believe the messaging has gone far. And I've had, my family, a lot of my family's down in the GTA, and I know they're watching Sudbury, but they're hearing these messages, both, from Sudbury, they're hearing it from Muskoka. Mayor Tory has been messaging about, travel, and so everyone in the GTA is very aware of what's happening because of their situation. So there's a very heightened awareness across the entire province.
Right.
And so, I am continuing to rely on the advice and support that I'm getting from our chief medical officer, Dr. Sutcliffe, and we'll consider it, if and when things change. However, what I'd like to also point out, though, as a municipal mayor, really the under a provincial state of emergency, there may be jurisdictional considerations as well. And so with the concerns down in the GTA, obviously if we saw that the GTA and Toronto were having similar restrictions, that would be something important to take note of. But I think at this point in time, to close the Trans-Canada Highway, which is the provincial highway going through the city of Sudbury, any one of them is up to the province at this point in time. And I have spoken to representatives from the province. This goes day by day.
Sorry,
but at this point in time, I don't have any indication that they're considering that level of action yet in Northern Ontario.
Under the state of emergency that you declared, do you have the authority to close off the city?
Well, as I said, it's a question of jurisdiction. If we were dealing with a forest fire and I believe it to be an immediate threat to people's safety, I believe it's action that I could take. Essentially, the powers of the municipal auditor are really limited to don't do something that's unlawful, and yet, because the province has declared a state of emergency, they're aware of the media. I guarantee they're aware of that topic of discussion. And as I said, I've been in contact with members of the Ontario government, but at this time, I don't see it happening. Things change very quickly.
Okay. Dr. Sutcliffe told me the same thing when I spoke to her, that she doesn't think it's necessary to close off the roads or close off the north, with the caveat, of course, that it's unnecessary as long as people stay home and are physical distancing. It's sort of unnecessary. I guess what a lot of people are wondering is, why not take that extra step to keep people safe and simply, at least for this weekend, close off the city, prevent people from traveling in or out, and just lock the place down. Just as Dominic Giroux said today, this could be the make or break weekend for Sudbury.
So Mark, everything always sounds very easy when you first think of the idea, and so I mean, just as a point of discussion,
Yeah.
So if you're going to shut down the Trans-Canada Highway, what about the airport? Now that's federal jurisdiction, but people can fly in. And what about CN and CP Rail? People could come by train, and so forth, right? So the thing is that if you're truly closing things down, this is a very big ask. It's not as simple as simply saying it will be and it happens here. Also, you do need resources to implement road checks and think of how many roads that we might have to actually have people doing those road checks on. And you think about what's being carried down the highways, and maybe it's a load of masks for Timmins, and so are we delaying that load of masks from getting to Timmins? So you have to be very careful to consider, and this is not a no. This is just saying that there's a lot to consider, and you have to be careful not to implement something that has worse impacts somewhere else.
Okay. What are your Easter plans this weekend, Mr. Mayor?
Well, clearly I'm calling you from home, and I'm at home. I'm staying at home as much as possible. I went in for the declaration of the emergency. Other than that, I've been just at my house. So it's my wife and I at home. I will connect with my family, my kids, my grandchildren, my parents, and family members, all basically down in Southern Ontario. So we'll connect through phone calls and Zoom and FaceTime and all the technologies.
Okay. Mr. Mayor, Mr. Brian Bigger, I appreciate you spending some time with us this afternoon. Readers, I'll be back in a couple of hours, or about at 4 p.m. With MPP Frangelina, the NDP healthcare critic. So we're having another live chat this afternoon with her. For all of your regular news and all of your COVID news, remember to head to Sudbury.com. There's always something new there for you to find and to read. And Mr. Mayor, I wish you a happy Easter and stay safe.
Stay safe. Happy Easter to you as well.
Good afternoon.